Vagina is a taboo word in most cultures. The significance of vaginal microbiome is very high when it comes to health of a woman, her partner, and her kids. We need to talk about vagina and vaginal microbiome because vaginal microbiome represents not just health of a woman but the health of every generation. Vagina is home to a complex microbial community that mainly includes bacteria, viruses, protozoa, and yeast. There is a delicate equilibrium that exists between our human cells and microbes in vagina. The equilibrium can be disturbed by a variety of reasons such as menopause, introduction of new microbes during sex, and antimicrobial use. These changes could result in an unbalanced microbial community. Such an imbalance could increase a person's risk of contracting pelvic inflammatory diseases, sexually transmitted diseases, including chlamydia and HIV. So, how does this vaginal microbiome change during one's lifetime? A healthy vaginal ecosystem is dominated by a specific bacteria called lactobacillus that produces lactic acid and other chemicals. A healthy vagina is acidic with a pH of 4.5 or less and keeps a check on the growth of harmful bacteria and even yeast in our vaginal ecosystem. During early childhood, the vaginal pH is either neutral or alkaline, and the vaginal community is similar to that found in our gut or skin. During the reproductive years, menstrual cycle with hormonal changes helps keep the vaginal microbiome in a healthy state. When one is pregnant, there is even higher levels of estrogen and higher stability of the microbiome. During menopause, the menstrual cycle stops and the vaginal epithelium becomes dry. This leads to a reduction in the lactobacillus and a rise in vaginal pH, resulting in increased urinary tract infections and yeast infections. Now let's talk about when there is an imbalance in this ecosystem. An imbalance in the ecosystem leads to what is called as vaginal dysbiosis, and this can result in health conditions such as bacterial vaginosis. It's also commonly referred to as BV. BV is approximated that 1 in 3 women would experience BV and the symptoms. BV causes thin vaginal discharge with a fishy odor. In terms of composition of the microbiome, BV is characterized by a shift from lactobacillus-dominated community to an overgrowth of mixed anaerobes. Often, BV can be confused or misdiagnosed with other conditions such as yeast infection, aerobic vaginitis, or other STIs. BV can be recurrent, and recurrent BV is when the treatment initially allows the symptoms to disappear only to reappear after about 4 months. Microbiome testing helps us to characterize this community and allowing us to correlate what microbes are present to what symptoms are experienced by the client. This also allows us to describe the antimicrobial resistance profile, allowing the right therapy and even helping in cases of recurrent BV. Vaginal dysbiosis during pregnancy is yet another important topic that needs to be discussed. This is because a subset of bacteria in the vagina has the potential to ascend into the uterus and gain access into the amniotic sac and the fetus. This could result in rupture of membrane before term and even preterm birth. Preterm birth often brings to the mother and the baby a course of adverse outcome and a difficult journey of recovery. It also puts a heavy burden on the healthcare system. These conversations about vaginal microbiome need to happen among ourselves, within our families and society. When we talk about health and wellness, let's make it a point to talk about vagina and its microbes. I'm Teenus Jayaprakash, and I work as a microbiome and genomics scientist at BioArrow. I have been working with microbiome for the past decade, and I am excited to be part of the team at BioArrow that is offering microbiome testing. Thank you.